you're going to be able to ask questions live, and we'll be answering those. If for some reason, somehow a question slips through, or we end this and you have other questions, please know you can call our baby line, and you're going to hear me say that many times in this presentation, but you can call our baby line and we'll be able to answer all those questions for you. Okay, so let's get going. The Fudge Family Birthing Suites, we're so excited to roll this out through Irvine and expand our Newport deliveries. So you're going to be virtually in admission from admitting to discharge, you're in the same room. So you labor, you deliver, you recover, all in that same birthing suite. I was fortunate enough to be down there last week and saw our birthing suites, and they are amazing. They are so fun. I have no children pregnant, and I went home and said, you have to deliver at Irvine. Although Newport is where my heart is, and enjoy that, but they're just amazing. So it's fun to be able to bring this to you about that. So meeting the needs and what you people have asked for, and that's what we're doing in rolling out these birthing suites. So the maternity care, you can see, so they're showing our birth suites. There we have 12 private birthing suites for you. You can look and see the bathrooms are in there, refrigerators in the room, very calming walking paths, different things to bring your new baby into the world. We have 2 designated operating rooms for cesareans if those were needed, and we also have a nursery for that baby. But the whole idea of the birthing suites is that your baby stays with you, and you're in there with your partner and your baby and the whole birthing process, which is just so amazing. So here's an up close look at it. You can see the little patio, the bathroom in there with the bed, the crib for the baby after they're born. But we do a lot of skin to skin, keeping that baby with you, especially right after birth there. Valet and Self-Parking, so the hospital there right now, due to COVID, we have no valet. Self-parking is free. So you would just enter that main lobby area, and the birthing suites are very close to the main entrance. So visitors, back again, this is pre-COVID, or for when COVID does go away. So we'll talk about both, but general visiting hours are 9 a.m. to 9 p.m. But with COVID, we are not having visitors. You can have your support person who will be provided 24-hour access to the hospital. That is with, of course, your approval as the mom of who is there. And that one person with you is the person that is there with you the whole time. So it's not switching out with that. Children visiting, there will be none during COVID, but after COVID is over, then you can have someone there. Anytime the child is there, though, you must have a support person for that child there. If you'd like a doula, you can have one. The doula prior arrangements have to be done, so check with your midwife and or your OB to get that, approved with that. And of course, they must follow the PPE guidelines as far as masking and those guidelines that we follow. So if you have questions, the Hoag.org and then /visitors -policy will keep you updated, because as we know, if 2020 has taught us anything, things change rapidly, and with COVID, changes could be coming forth. But right now, those policies are in place for what we just talked about. So meeting your care providers, we have OB, your OB gynecologist. We all have a laborist who's there. If for some reason your midwife wasn't there, or your doctor, we always have one there to look and see how the baby's doing, or questions for our nursing team. Neonatologist is a specialty doctor who takes care of your baby. If anything we had questions about, they are there in-house. Anesthesiologists are there for epidurals if you choose to have that done, or you have a cesarean section, we have that. Perinatologist is someone who takes care of it for a high-risk pregnancy, or any questions your OB might have. We have perinatologists to answer those questions. You might see them, you might not. Not everyone does. Pediatricians for the baby, and both your doctor and the pediatrician will see you every day that you are in the hospital. Certified nurse midwives are there to also deliver, and all of our nurses are specially trained to assist you in the different aspects of your care and birthing your baby, which is such an exciting time for you. So going through labor, one of the, benefits of that birthing suite and being in there the whole time, and again, we listen to you and what you asked for in the community and bringing you those things. So if you want an epidural, you can have an epidural. If you want oral or intravenous medications, of course you can have those. But we do a lot with other things, and birth and peanut balls are in the room. So it's things to always making yourself comfortable and trying different positions and moving, which is so important in labor. We have rocking chairs in there. We have water and aromatherapies that you can use. Movement, of course, we know helps with labor. It helps move that baby down and actually shorten your labor by move, not just being flat on your back in bed, which can actually slow down labor with that. So we encourage that so much. Touch and massage. And we're going to talk about classes and continuing that. And again, with COVID, that has changed how we do classes here at Hoag. And we encourage you, and I'm going to talk about the classes, but still it's so important to watch those with your partner to help you through that whole laboring process with that. Visualization, mindfulness. We have a mindfulness class. Different kinds of therapies as far as water, doula support if you choose to have that done. The NurtureVR, which we'll talk a little bit more about. So that is rolling out very, very soon. It is one of the, basically the first of its kind to go through there. Follows you through prenatally and even after the baby's born with that, and all the studies that we've found with that of lowering your stress and promoting the well-being of both you and your baby. We developed it with moms to assist you. So that's a program, again, that's coming out very, very soon. So stay tuned, check with your healthcare provider when we get those rolling out. It's really exciting. Bonding with your baby is one of the most important things you can do. Your partner, if the partner chooses to cut the umbilical cord, they may. With that skin-to-skin time, so we call it the golden hour, and I always say it's not just an hour, it can be as much time as you want, but that baby comes out, mom's okay, baby's okay, we put that baby skin-to-skin directly on mom's chest. We know through science, evidence-based practice, that babies regulate better when they're skin-to-skin with their mom. Their temperature regulates, their heart rate, their blood sugar. They release less stress hormones, so they actually acclimate to the world so much better because they're, in the perfect world, I always say they're in nirvana and then they come out to this world, and it's not always a perfect place for what they want, but they go skin-to-skin with their mom, and they release less stress hormones. They are just, that's where they want to be. So it's never a bad time to do, because all your babies are born awake, and they stay that way for a few hours and then go to sleep. So we like to keep them skin to skin. But of course, if mom wants to take a nap, then as this partner is doing there, baby can go skin to skin with you, or if you both need a nap, whatever, we are here to work with you through that. And of course, initiating breastfeeding. In a perfect world, we'd love to get that baby to the breast as soon as possible, but don't be alarmed if your baby doesn't latch right away and start feeding, because they don't all do that. Just keeping them skin to skin, it actually imprints on their brain, and they remember what they're doing when they go back to the breast. So they all just do it in their own time. I call it tincture of time, and how long it takes them to go there. And we're here to help you through that process. So postpartum, post meaning after the baby's born, and the care for both of you. Your healthcare providers will visit you each day, as far as your OB or midwife and the baby's pediatrician. Baby stays with you, which we know is so important. In the old days when they used to take the babies away, and we found that's not the best thing to do. So we've gotten much smarter about that just as a society with that. Quiet time, which is really important. Mornings tend to be busy when everyone's coming into the hospital, as far as your doctors and things like that. And then we give yourself, allow yourself that time to rest, which is so important, and just take in that whole birthing process with that baby. We do cue-based feeds, and we talk a lot about that, of watching the baby, and we teach you how to start recognizing when your baby's telling you they're hungry. Your baby speaks a language, but it's different than the language you speak. So it's starting to say, wow, this is what my baby's telling me. Oh, those are the feeding cues. Oh, I think the baby's hungry. Put the baby on the breast. And of course, we work with you with baby care. We teach you diapering. We involve you in all the care with the baby, which is so important with that. Mother-baby couplet care means that your nurse takes care of both you and your baby. So it is a better type of nursing care because it's not separate nurses taking care. It's continuity of care with you can ask any questions about yourself or your baby to that one nurse, which is so, so important. We do a celebration dinner. So for you and your partner, we will bring in basically fancy food and fake champagne, as I always say, for that. So we celebrate you with that and the birth of the baby. All is right in the world with the birth of a baby, for sure. All of our RNs are trained in lactation. We do have lactation consultants that do work at Hoag with that. And of course, security 24/7. And 24 hours a day, 7 days a week. Those of us that work with babies have a pink stripe on our badge, and you'll see that. Our doctors have green stripes. Anyone else who works in the hospital has a blue stripe. It is only the pink stripes who may physically move your baby in and out of a room with that. So some of the procedures that we do before discharge, there's lots of screenings that we do on your baby to make sure that everything's looking well before they go home. No news is good news. We don't, your doctor gets all that information, so they will tell you if there's anything that is an issue or needs to follow up with that. The birth certificate and the Social Security application will be started for you with that, so have those names picked out. So when you leave the hospital, we can file all that information, then you don't have to do that yourself with that. If you have a boy and choose to have him circumcised, that will be be done before you go home from the hospital. So that's something else that you put on your let's talk about that. Are we going to do it or not do it with that? Other things to talk about with the vaccinations and medications. So we do an antibiotic eye ointment, that is a state law, and also the vitamin K injection. The hepatitis B vaccine is voluntary. That is the one vaccine we will start in the hospital. You get to make the decision on if you want to start or not. It is a 3-shot series, and the first one would be started in the hospital. So just talk about it and decide, is that something we want to start in the hospital, or otherwise you would just do it in your pediatrician's office or healthcare provider. If you have family practice or whoever you go to, then they would start that there in the office with them. We are a licensed level 2 special care nursery. For that, we have, again, the neonatologists, who are the specialty doctors who take care of babies. Whether they need a little bit extra time being looked at, then they would be in the nursery, and the neonatologists in there and specially trained nurses are there taking care of them. You can see we have lots of subspecialists, so anything we can have them looked at about that. We do partner with CHOC, so anything we are concerned about, we would be working with CHOC for that. We have a transport team, a developmental care clinic, lactation support, of course, we always do have that for you. And you are able to go in and out of that nursery with your partner as needed for that. Any kind of transition to home, we have education for you with that. We don't just cut you loose and send you home. We're always here. You get us all the time. And we'll talk more about that too, and how we take care of you moving forward. So, Breastfeeding Resources. And we are evidence-based in our lactation support, and we've got different things. Of course, with COVID now, we do have virtual support groups. With that, we have one for multiple miracles, which is more than one baby at a time. We have a Zoom support group for that. For tiny miracles, babies that are in our intensive care unit going home, we have a group for you. We have a breastfeeding support group that meets on Tuesdays. All these things can be found online, and you can sign up for them. with that. So the Hoag Baby Line, I talked about that earlier. Baby Line is your phone a friend. It is my department. So again, we're all registered nurses. We're all certified lactation. We're internationally board certified lactation consultants who answer that phone. You can ask us questions about your pregnancy, your delivery after, so mom, how you're feeling, the baby, breastfeeding, umbilical cord, going back to work, starting solid foods, any kind of questions, you can call us. We are not 24/7. We are there Monday through Friday from 9 to 4:45. Most of the time you have to leave a message and we do call you back. So again, that number 949-764-BABY or 764-2229. And please call us. I always tell when I see the moms, I go, you know what, you call us 10 times a day if you need to, because we are there to support you. I have 3 Hoag babies of my own. I called Baby Line. I wasn't doing this when I had my children, and it's just such a great way to get your questions answered. We also have a breastfeeding clinic. So once you go home from the hospital, you need questions answered, reassurance, any kind of issues, you could always call the Baby Line and schedule an appointment to come into our clinic. It's a 1-hour private with a lactation consultant. We still are seeing patients through COVID. We have just staggered the appointments, so hopefully there's no crossover with that. And of course, we follow CDC guidelines in the clinic, and we're there for you. It's a $40 best deal in town. Just that reassurance given to you. You can come more than once if you need to with that. So we're there for you. As we are not 24/7, we have something called the Pacify app, as well as in-room education. So there are videos you can watch through your television while you're in the hospital. But the Pacify app looks like this. So this is your 24/7 support. So this is Hoag's gift to you. And that is when Baby Line isn't available and it's 2 in the morning and you are crying or baby's crying or you have latch issues or just have a question you want answered. You can go on to the app and you can actually FaceTime with a lactation consultant. She's there for you, which is nice because that fills in that time. When you deliver, we will be giving you the code to get in. You can go ahead and download it now. Again, it's Pacify. Looks like this. It is purple if you go into the App Store and get it, and then we will give you the code to get into it once you deliver here. And all of our moms who deliver at Hoag are given that, which has been just so wonderful. What kind of things can you ask them? Anything breastfeeding related. So Baby Line is about mom, starting solid foods, all those things we talked about. Pacify is strictly breastfeeding, pumping questions, sore nipples, things like that. So that is our gift to you. The Fudge Family Birthing Suites and all the comprehensive services we have, whether you need, and a lot of these you might not need, but you might. And just know that we are here for you in all aspects of your pregnancy and even after delivery with that. So our Sweet Success for gestational diabetes, our OB education classes, and you can get those online at hoag.org and then /OB education on there. Hoag for Her, we have a whole maternal mental health area, pelvic health, bridges, and we'll go into a little bit of detail on these. So there's the OB education classes, which again is my department. Due to COVID, we no longer have in-classroom classes. I'm holding out hope that we get those again in 2021. Is going to be a different year. But until then, we have brought them to you in so many different ways. The childbirth preparation is the one that we charge for. It's a $40 fee. But that's the one I want you to watch with your partners because that brings you through what to expect. When to come to the hospital, what's labor going to be like, different phases, stages of labor, pushing, all those things. So that's a great one to sign up for. There's mindfulness workshops, again, another area to help you get through that labor process. Breastfeeding education, the Breastfeeding Baby Saver, Baby Care Basics, those can be accessed through Hoag Health on YouTube. And those are archived. We have breastfeeding, a couple of them, first 24 hours. We have a pumping class. We have a benefits of breastfeeding and then an actual breastfeeding session that you'll see. I'm actually the one who does the breastfeeding baby saver with safety tips and learning CPR for your infant, that we have baby care, different aspects of taking care of your baby, and those are all free. So I really encourage you to look at those for sure. We have a 4th trimester class, meaning what happens after you bring the baby home, and then again that NurtureVR, which is rolling out very, very soon. Our Hoag for Her Center for Wellness, that is in the Hoag Health Center, Newport Beach, which is 500 Superior. Some of you might have your OBs in the same building. Our OB education department is in that same building, and they offer all types of services for you through fitness. Some of those you can do. They have online yoga classes that if it's okay with your OB, and you could sign up and take those. Pelvic health, Pilates, sexual therapy, massage therapies, all kinds of things that you can access with them, and we will have that number online for you that you can call them through that. Also, the maternal mental health, we have a phone number for them too that we will list for you to be able to do that. But all kinds of support groups for you. We hope to catch all types of avenues of things that you might need for that. Bridges for Newborns is a program for our moms who need resources in the community, and we have those, so that if that is something that you're looking for, there's the number there. I would give them a call. Things like even home visitation as needed, or public health nurses that will be able to help you with that. Hoag Healthy Together app, I would encourage you to download that now if you haven't already. All kinds of things in there for you to help you through. I mean, you can register for classes, you can, birth plans are listed there, different things that you can have every trimester, and listing what's going on with you and the baby, and there's just a wealth of information and things to help you through this journey. So look for that one. COVID-19, here we are, and we have definite safety measures. I would look them up because, as we talked about earlier, they definitely are changing. So hoag.org/COVID will give you the most recent updates as far as visitors or anything that we are doing. So just know that we're here to keep you safe. We do follow CDC guidelines with that, but the policy for visitors might be updated. Staying safe while you're pregnant, and definitely COVID while breastfeeding, all that is listed on there, and that's information for you. Questions at all, you can always check with your healthcare providers also. So what to bring to the hospital, and you get to the fun stuff. You've been waiting 9 months. Well, don't wait till the 9th month to start thinking about this, or the very last day. And definitely, as you get into your 8th month, approaching early on in your 9th, then, or 36 weeks, start getting your bag together of what to bring to the hospital and what should you bring. Medical insurance card, I mean, all of this, identification, your list of if you have any medications or allergies. Forms for your provider are things, sometimes your doctor will give you forms to bring into the hospital, so make sure that you pack those. Your birth plan, any comfort items that you like, anything that brings you comfort at home will also help you in the birthing suites. Cell phone, don't forget that. Don't forget your charger. Also, don't forget to take your charger when you go home. It's one of the first things we check as you're on your way out, just to make sure, because they do get left behind on there. So mark those, but don't forget to bring those. Comfortable clothes, footwear you can wear. You want to wear your yoga pants while you're in labor, you absolutely can do that. Comfortable clothes to go home with. Glasses, contact lenses. I usually tell people when they pack to come to the hospital, pretend like you're going to a hotel overnight. So you don't need to pack like you're going to Europe for a week. As it's what would you take? And when you pack to go to a hotel, pack like you're having room service and never leaving your room. That's the way you want to pack. So, sometimes women wear their clean clothes in, take them off, might use our gown while they're in labor, and then go home in the same clothes. But pack, don't forget your hair, products, lip balms, shampoos, those kind of things that you like. If it makes you feel good at home, it's going to make you feel good while you're with us in the hospital. Speakers, headphones, Do you like music? You have that little speaker, you can bring that. Once we roll out the NurtureVR headsets, bringing those with you. Visual aids, things to help you get through, and all these things we talk about in the class, that the childbirth preparation that you can sign up and take. So I would really look at those and make notes and bring in things accordingly. This list sounds like there's a lot of things, but it's not a lot of things really. iPads, if you have that, tablets, face masks, of course, those are a part of our life now. I say treat yourself to a new one to come into the hospital. That would be fun too. Colored pillowcases. A lot of people want to bring their own pillows in, which is absolutely fine. But I would put it in a patterned pillowcase or a color, because our sheets are white and it will get left behind and you don't want to lose your favorite pillow there. Any miscellaneous personal items, but again, a small bag is all you need, because you're not here with us for a week going to Europe. So packing accordingly. As far as the baby, as you can see here, this baby is swaddled in a blanket. So baby has a t-shirt on while they're here in the hospital. They're swaddled in one of our blankets. Diapers, of course. We provide you with what you need as far as diapers, wipes, while you're here in the hospital. Mom, anything you need afterwards, we have that for you. That baby does have a hat, Hoag hat, that is yours to take home. So blankets and t-shirts stay here, and then we ask that you bring in an outfit to go home. Remember that it's going to forever be photographed with that baby going home from the hospital, so you want the cute outfit. And you also, if the grandparents have given you one, I would bring them home in that one, because I'm pretty sure they're guaranteed to pay for college if the baby goes home from the hospital wearing that outfit. I can't guarantee that, but I'm thinking maybe that might be the case. So going home with an outfit, also a receiving blanket, and of course the car seat. The car seat should be installed in the vehicle, and that's something I encourage you to go research different things. CDC has it, the American Academy of Pediatrics, actually the Auto Club, if you are a member of AAA, they have some classes online to go learn. It's harder than you think. It's not that hard, but it is harder than you think. So learning about that. The only reason the car seat would come into the hospital is if we have asked you to do that. So if your baby is born a little early, we might ask them, because we need to check the baby in the car seat, but otherwise the car seat stays in your car. Practice even putting a doll in it or a teddy bear to get that practice with that. So extra person, or your support person, your partner, extra clothing for you, of course your mask, snacks, cash. There are refrigerators in the room, so you can bring in some food and store it in there. Now mom is fed while she's here in the hospital, and for partners due to COVID, you will have the ability to order food. You can put it on your credit card and they would bring on the tray of food at the same time they bring mom, so you can eat together. Otherwise you can have Postmates, you can have someone deliver food to the outside and pick it up that way too. So there's different choices for you. And then any personal items, again, that you would need while you're here. Bring your bag, can take showers. We'll bring you blankets, towels, things like that you might need. Hospital to home. Now the labor really starts and really begins going home. With that, your healthcare provider will decide or determine the length of stay that you're here with us. Uncomplicated vaginal deliveries, you'll go home 24 to 48 hours, and most of our C-sections will be home in the comfort of your own home by day 3. So no, that's how you look forward to that. Pre-registering, something else you can do now. If you're close to your delivery, I hope that's already been done, but otherwise there's different ways you can do that, either online, hoag.org/pregnancy. You can actually download a PDF file and mail it in if that is your choice to do that. Or there's a couple numbers there that you can also call and you can pre-register that way. But you definitely want to be pre-registered before you come in. It's just less stress for you when you do come in for that. And then of course on approval from your provider coming into the hospital here at Irvine. So what should you do now? Visit our website, hoag.org/pregnancy. Complete your registration, register for those classes, start looking at them. Again, if you have any questions at all, call us on the baby line. We'd be happy to answer them for you. There's that baby line number again. We talk so much about baby line, and I have people, I've seen them in the hospital or maybe in the clinic, and I've had them say, no, how much is that baby line? I tell them it's free. It's free. You call us 10 times a day if you need to. With that, we're here for you. Choose your baby's pediatrician. Start talking to family members, coworkers, neighbors, again, all safely, hopefully over the phone or via FaceTime, and find out. Ask your OBs for recommendations, and then start researching those pediatricians. Educate yourself on the immunizations. Remember, the hepatitis is the one that we will start in the hospital. So see if you want to start that in the hospital. If you have other questions, and a lot of people do on immunizations, again, you can follow up with the American Academy of Pediatrics, the AAP, the CDC will answer all those questions for you. And please look at evidence-based practice. Talk with your OB or midwife about your birth plan and your decision to deliver at the Fudge Family Birth Suites. They'll answer any questions you have for that. Preparing to take your baby home. Again, that car seat is important. It is a state law that you have a car seat. Have that in there. And then start thinking about your home. You're bringing a baby in. Yes, for the first few months, the baby's not moving, mobile, but they soon will be. So start looking at that. We do have in our Baby Saver class at Hoag Health YouTube, there are things where we start talking to you about preparing your home and that, but there is companies you can have come in, you can do it yourself with that. If you look at home safety for babies, you'll get so many different hits online if you look at them. So and then start researching cord blood banking as an option. It might be something you're interested in. So that takes you through a brief overview of our birthing suites here. I'm going to check and see if we have any questions that haven't been answered so far, and we can answer them.